use it very wisely, it will be very useful. But if you use it not according to its not according to the knowledge, you will end up in misery. So you should be very careful in using the rasa aushadhis. But if you are in touch with the different things, aspects of the rasa aushadhis, how to apply it, then you will have an additional edge over the other practitioners. So let's move on. By applying Resaushadhis to meet current health issues, that's a major area which we want to discuss. Then exploring Rasa Rasayanas. Actually, these Rasa drugs are not poisons. You don't fear it as poison. When it is processed well, they are all Rasayanas. So why you are fearing these Rasayanas? So ensure the source, a genuine source in which you can procure the results of these, or you have to prepare it either or procure from a genuine source. So then, if you select a genuine resource, then it is a rasayana, not a poison. Don't fear it. And it's a call for revitalization of rasa chikitsa. It's a need of the hour. So, from principles to practice. So, you should understand the pathology first, starting from the Jwara to Vadarakta, which is essentially established in our classics. So, you should be aware of that pathology and you should be able to use the Rasaushadhi according to the pathology in the patient, not merely looking into the indications of or a catalog. You can't use it uh, right. So you should be very familiar with the pathology. You should understand the pathology of the patient and then select the resolution in a wise manner. Then only you will get good results. So, implementing suitable treatment protocol to the present circumstances, the Jwara, the Rogas. So, starting from the Jwara is very important. So, in every disease you can find Jwara. It's an inflammatory process. So, you can see a lot of resolutions which can be used in Jwara. So Vettumaran Kuliga is a very important one which is used in South India, especially in Kerala and Northern Kerala. Surya Prabha Kuliga is another one which is established in Sahasra Yoga. Then Ananda Bhairava Rasa is important one in Jwara. Hinguleshwara Rasa itself is very good in Jwara. Arogya Vardhane Rasa is also indicated for Jwara. So what I am asking, how you select one to your patient? When a patient comes to your clinic before you, how will you select the medicine? If the Vettumaran Gulga is not available in your stock, you are suggesting Surya Prabha. That's not the way. That's not scientific. So you should be able to use it in a very specific manner. Then only you will get the instantaneous result in the patient. So there will be a differential use. So you have to understand the differential use. So I am asking you a question, whether you can differentiate the use of Vettumaran Guliga with Surya Prabha Guliga or Arogya Varthivirasa. This is make you think how to apply the Rasaushadhi in specifically to the patient. So can anybody reply? You can also participate. I'm just asking you, your answer may be anything, but you can respond. Yeah, you can respond because it will be more good if you respond. So anybody, how will you differentiate this Vettumaran and Surya Prabha or Arogyavardhani Rasa if a patient approaches you with fever or like it, a fever-like infection? How will you select?
Sir, we usually prescribe a Vettumaran Guliga because I am a very poor person who do practice in Rasaushadis.
Yeah.
As you had told in the first line itself, Rasaushadis are, as we think, it's very dangerous.
Yeah, no need to fear about it. If you purchase it from a genuine source, then if the processing is correct, then you should not be fearful. You can use it.
Right.
But you suggested that you are using Vettumaran, but
Yes.
I can make some points clear that you can use it in very specifically. So Vettumaran Guliga and Surya Prabha Guliga, it is a practice of many of the practitioners that if one is available, then they will give it. And if it is not available, they will go for another. That's not the case. So we can use it in a very specific manner like this. I can tell you. So Vettumaran Guliga, what's the speciality of Vettumaran Guliga? What is the speciality of Surya Prabha Guliga? So that we should understand. Then you can apply it in lot of circumstances which you come across in your patient. So Vettumaran Guliga, it contains Hingula. That's a major difference from Surya Prabha Guliga. But Surya Prabha Guliga doesn't contain Hingula, but it contains Kajali. So that is major difference between these two. And you can see that in the combination of Vettumaran, you repeat by saying Vettumaran, Vettumaran, Vettumaran. You repeat that word, Vettumaran. So it's a Malayalam term or a Tamil term which indicates it can subside Vettu. Vettu means seizures. So it is very good in a fever which is having high degree of temperature. You can use it very well if you make Vetamaran with its all the contents in that proportion, a very good stuff. I can assure that even in 103 degrees Celsius or more, you won't refer the patient. You can treat it by this Vetamaran in high degrees of fever. So it is said in Sannipada Chikitsa. In Jwara Sannipada, it is said, even in Sunnis, 13 Sunnis are enlisted, in which they are acute infectious states. And you can use Vettumaran. So Vettumaran, 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 you repeat that word, every Malayali can understand. It can arrest the Vettu. Vettu means the seizures. So the febrile seizures in which when the temperature rises, it turns out to be febrile seizures. And in those cases, you can treat that infectious episodes with the Vettumaran Guluga. So this child, yeah, that is the Hingula is very much good in decreasing the inflammation, in addressing the inflammation and infections very well. Hingula has that property to address the inflammation and infections. But if you look into the Surya Prabha Guliga, it contains Kajali. Kajali is more Sukshma and Vevai. So it can act to deeper dhadus. And you can see that in the indication of Surya Prabha Kuliga, Kasa Shwasahari Mahajurahari Namnatu Surya Prabha. So, Sulabha Handri Param Kasa Shwasahari Mahajurahari Namnatu Surya Prabha. So, along with a fever, a patient is approaching you with a chest infection. This Surya Prabha is very specific. So you can differentiate the two. If a patient coming with you with fever have a chest infection, then you can rightly pick the Surya Prabha and it will give the result very specifically. So what is my point is that you have to be specific while choosing. Even Jora is indicated in both, you can make it more specific in your use. So then this clinical precision will make you very apt and your result will be arriving within hours. You will get the result. So Kasashwasahari Mahajurahari Namnatu Surya Brava. So you can even use it for COVID infection. It is an inflammatory process in which the lungs are get inflamed. The pneumonitis will be there. The pneumonia can happen, and in those inflammatory stage, when you use it, the Surya Prabha Guliga at the first instant, the pathology will not progress. The Kriya Kala, we are arresting the Kriya Kala. It will not go with that Kriya Kala. So it will not go to a pneumonia like condition. So we can arrest it when we use Surya Prabha very early. Likewise, in all the viral infection and viral loads in which the fever contains viral loads, Surya Prabha is more specific since it contains Kajali and it is going to the deeper dhadus. So the alveoli and the tissues can be responded well by the Surya Prabha. Then now coming to the Ananda Bhairava Rasa, Hinguleshwara Rasa, Arogyavardhini Rasa. So you can see Ananda Bhairava Rasa, it is more specific in Kaphavadiga Jwara. While Hinguleshwara Rasa is very much specific to Vadiga Jwara. So how you differentiate this? How you can diagnose a Paitiga Jwara? The cardinal feature you should assess in the patient. The cardinal feature is that Nayane or Daha. So in that Paitiga cases, Nayane or Daha, you can add Guluji Sattva. You can combine Guluji Sattva with this so that you can treat the Paitiga Jwara. So the Sahapana and Anupana plays a very good role. Even in Vettumaran Guliga, if you change the Anupana, you can use it in many other instances other than fever. Say, if the patient has a urinary tract infection, and if you give the Vettumaran Guliga along with Nalige Rodaga, that is the best thing. The cardinal feature of this urinary tract infection is nothing but the frequency of urination, the urgency of urination. The patient will be fed up with urgency of urination. So you will be giving Brihatyadi Gashaya, Bluchadi Gashaya and all. Along with that, if you use Vettumaran Guliga, along with Nalige Rodaga Sahapana, 250 milligram, one or two times, you can control very well the urinary tract infection. You won't go for an antibiotics. You can clear it. So what I am telling you is that you should also select the Anupana rightly. So in a Chardi, the patient is have got Chardi, Chardi can be controlled by Vettumaran for many instances, not all. You should know the reason of Chardi also. But if you give Kachola Swarasa, Kachura Swarasa with Vettumaran Guliga, that will be controlled. And you can also combine Mayura Picha Basma. So that makes sense. So you have to select the Anupana and Sahapana accordingly, and you can control many other pathologies, even which are not indicated in the Rasaushadhi. So that is very important. Now coming to the Hinguleshwar Rasa, there is only 3 ingredients in that. So what are they? The Hingula, Pippali and Valsanabha. So Valsanabha is also very good in controlling the inflammation along with Hingula. And you are using Pippali there. So these are the 3 constituents. So what I am telling is that you don't want to fear. It is hepatoprotective. So when you are processing it rightly, Valsanabha is Pupusa Shodhahara. It will control the inflammation, as well as it is highly it can control temperature. It is Tabahara. Along with that, you are using Pippali in the combination. The 3 constituents. So Pippali is highly liver protective. So what I am saying is that it is very much safe than a paracetamol. So everybody is using Dolo and paracetamol in our public, and it is we can replace it by this simple Hinguleshwar Rasa, which can control the temperature as well as it is hepatoprotective than using a paracetamol. So that is the what that makes sense. We can replace that, and we have to educate, and we have to act accordingly. We have to be very specific while using these medicine. So Arogya Vardhane Rasa, the use of Arogya Vardhane Rasa is very much different. It's differ from the above, that it is more apt in Dhadu Kshaya Avastha or Dhadu Lina Avastha. Why? Arogya Vardhane contains 50% of Kadurohini, which is more specific to liver. So dhadu kshaya means it will affect the rasa dhadu, rakta dhadu, and all dhadus get affected. Not only the jadaratni, the dhadutnis are getting affected. So in that case, arogyavardhani is needed. Similarly, the infections like dengue hemorrhagic fever, in which the liver is affected and the spleen is affected, you can use directly the arogyavardhani rasa. And also in different jaundices, you can jaundice and hepatitis, you can use Arogyavardhani rasa. So what I am making you understand the differential use of all these rasa aushadhis, so that you can use it very specifically and precisely, and you could arrive at good results. That's why I am telling you how to differentiate this. Otherwise, every drug has indication of its own, but don't use it by indication alone. You have to go into depth how it can be differentially used. So these are my points, and you can make use of all this in your clinical practice. Now coming to Jara, I should again differentiate this Aganduga Jara. First, Aganduga means it can be an amatu or from a food poisoning. It is a Aganduga. Reason is Aganduga, but it can bring in different disabilities, a different situation internally. Inflammatory process sets in. So Sanjeevani Vadi is the best one, which contain Varsanavi and Gomutra. So Sanjeevani Vadi is very useful in the Aganduga Jara, and I can correlate it with many conditions we can comes under this, like food poisoning. You can use it. And Nija Avastha, you can use differentially the Vartamaran Guluga. In Paitiga Avastha, you can combine it with Guluji Sattva. Then Ananda Bhairava Rasa in Kabhavadi. Tribhuwana Kirti Rasa, in almost all fevers you can use Tribhuwana Kirti Rasa. There are 3 or 4 medias which are being made bhavana in the Tribhuwana Kirti Rasa. And it makes very sense in using these Tribhuwana Kirti Rasa in our viral logs. Then in Vishaja Jara, the seasonal fevers comes under Vishaja Jara. All the seasonal, when it gets rain, the patient comes to you with fever. So in that case, Surya Prabha is the best choice, which contains Kajali and Ramadha and all. And you can use it along with the Amrita Arishta and the Sudarshana Arishta. It will give very specific result in viral fevers. Then Vishama Jara, you can use Arogyavardhini Rasa, in which the Dhadus are involved, and you can use it in dengue hemorrhagic fever like cases. You can use the Arogyavardhani Rasa. Now coming to the Sannipada Jara, you can use Mrityunjaya Rasa, and the Purna Matra is 4 Guliga. There is a Purna Matra. And in the cases with encephalitis and all those which are being treated in ICUs, you can use these, which are medicines which are told in Sannipada Avastha. Now the order of hierarchy, Kabha Pradhana Sannipadam, Mrityunjaya Rasa, Jirna Jara, the patient is weak with chronic infection, you can use Lakshmi Vilasa Rasa. Then Sannipada, you can use Jayamangala Rasa and the Swarna Malini Vasanta Rasa, which contains gold, Swarna Basma, which will improve the bala of the patient. If the patient is in chronic infection, the patient will have low bala, so that he cannot catch up the treatment. So in those cases, the formulation containing Sorna will do very good, and the response will be much more comparing to other Rasa yogas. So in that case, you have Jayamangala Rasa and Swarnamalli Vasanta Rasa. And the Jayamangala Rasa is very much useful in pneumonia. It's very specific use is in pneumonia, and even COVID cases, even in one or two cases I have applied, which the patient was in ICU, and within 24 hours he shifted to back to room using the Jayamangala Rasa. It's very potent one. Along with Malla Sindura, I have used it, and the patient is shifted from ICU to back to the room. So the conditions and the oxygen saturation improved very much. So the Jayamangala Rasa, the yoga is illustrated here. You can get rid of the crepitus, which you, when you auscultate, the crepitus can be seen in the pneumonia, and you can get rid of that crepitus by the continuous use of Jayamangala Rasa for 14 days. But the dose you should remember, it should be 60 milligram or 65 milligram is a sufficient dose for Jayamangala Rasa. And in most acute cases, you can use it twice a day, then you can taper the dose. So Vasanta Maladi Rasa is also important in the sense that it contains Suvarna Bhasma, and it will increase the bala of the patient. And so if the patient is very much weak by chronic infections, you can use these Vasanta Maladis. So now coming to the Rakta Pitta, the second one, I am asking you, anybody of you treated Rakta Pitta? Anybody have treated Rakta Pitta patients in your practice? Have you come across that? Have you diagnosed that case which are coming before you? Can you reply? I am asking you just simply.
No, not much, sir. Not much.
Have you come across Rakta Pitta?
I have personally not, and we have some this answers in the chat box. Not yet.
Yeah. Okay. So it's our second chapter. Rakta Pitta in Charaka Samhita, Ashtanga Hridaya. Second chapter, next to Jwara. So nobody is actually knowing the patient before you. Actually, they are visiting you. The Rakta Pitta patient are visiting you, but you are not recognizing the Rakta Pitta. Since you doesn't get a picture about Rakta Pitta. So what I say is that when I say Kasisa Bhasma is very much good for Rakta Pitta, how will you apply? That makes nonsense. Just I am saying it is good for Rakta Pitta, but you should understand where to apply. So we can deduce what is Rakta Pitta. Then we can apply Kasisa Bhasma to that condition. Then you will flourish in your practice. So what is Rakta Pitta? It's a bleeding disorder simply, isn't it? Everybody knows this is a bleeding disorder. But how we differentiate with other bleeding? That's my question. How Rakta Pitta bleed differs from another bleed? That is the major thing which you have to understand. So coming to the Samprapti, Piktam Rektasya Virde Samsarga Dushanadabi. So Gandha Varna Anuvartescha Rektena Vivadishyande Prapravatya Asrajaha Sthanat Plihado Yagirdaschayat. Sthanat Plihado Yagirdaschayat. So that's a line of Samprapti in Ashtanga Hridaya. And in the third line it is mentioned Sthanat Plihado Yagirdaschayat. So those pathologies, bleeding pathologies in which the liver and spleen are affected, then you can recognize it as Rakta Pitta. So those bleeding have a pathology in relation with liver and spleen. And then what happens to the liver and spleen? You can see the splenic enlargement in many of your patients. And also some of the diseases which like idiopathic thrombocytic purpura, in which the bleeds are coming out from even the nostrils, even the mouth, oral cavity, the nostrils, the bleeds are coming out, and these are due to the pathology of hemoptysis. So the hemoptysis is affected in those patients. How the liver and spleen are affected. So Susruta have already stated that how recta is formed. So Yagasa Yagat Pliharo Prapya Raga Mubaidi. So it is formed due to the efforts of liver and the function of liver and spleen. So it gets affected. The pathology you can see, the pathology is in the liver and spleen, and the blood is not formed well. So if the blood is formed well, it will be in a balance of 5 stages. What is that? Vistrada, Dravada, Leguda, Raga Spandanam, Bhumyadinam, Gunaihi, Drishyande, Atra Shonidai. Nothing to worry. The 5 things, the blood, when it is normal, then it will be in a balance of 5 things. What are they? Vistrada, Dravada, Leguda, Raga, Spandanam. Bhumyadinam Gunaihi, Drishyande, Atra Shonidai. So these 5 qualities are in balance. But in Raktabita, it happens that the liver and spleen get affected, and it is this Mula Sthana of Raktavahasrodas, and it gets inflamed, and the hemoptysis is not happening well. So what is the problem in the hemoptysis? The Dravatva is increased. So because of that, it comes out of the capillaries. How? What is it called? How you can see that the pathology? The blood passes through the blood vessels, not all over our body. The blood passes through the blood vessels, and a patient having the dravatva of blood increased, what happens? The blood vessel, after that, there are body fluids covering the blood vessels, and they are demarcated by the blood vessel walls. Blood vessels walls are actually what? They are semi-permeable membrane. So the blood inside get loosened. There are tissue fluids outside, and in between the two fluids, there is a separation with a semi-permeable membrane. So what happens? This is chemistry. What happens? Can you say what happens? If the fluidity of the blood is increased, there is extracellular fluid outside. There is a boundary between the two which separates. That is a semi-permeable membrane. That is a blood wall, blood vessel wall. That is a semi-permeable membrane. Can you say what happened? What is the process happening? Anybody can answer. One word. What is this process called?
More blood pooling osmosis.
Yeah. It's already you have studied it in your high school or +2 classes, that when a concentrated fluid, it passes through a semi-permeable membrane due to the concentration difference. It is called osmosis. So actually the osmosis is happening here. So the blood goes out through the capillaries. So these are capillary bleeds. And in idiopathic thrombocytic purpura, you can see that you have in patient not heavy bleeds, but spots, bleeding spots, petechial hemorrhages. You can witness petechial hemorrhages. So that is this recta pitta. So you can group a lot of disorders and lot of pathologies under the pool of recta pitta, under the umbrella of recta pitta, and you can treat it. If you understand the pathology, you can treat it. And the best Rasaushadhi which is working in recta pitta is nothing but Kasisa Basma. which is called Annabedi Sindura sometimes, Kasisa Basma. It is excellent working in this bleeding disorders having a pathology in the liver and spleen, like the idiopathic thrombocytic purpura, you have hemophilia, lot of bleeding disorders comes under this. And at times some of the bleeding disorders like Glanzmann thrombasthenia, in which the lack of protein in the blood is the cause, but it can also be controlled by the Raktapitta Chikitsa, and the best Rasaushadhi which is working in this is Kasi Sagasma. So I am asking you one more question. Uh, I just ask you to involve in the class, not for anything else, not to harass you or not, just for a joke I am asking. So how this Kasisa Basma can be administered to the patient? How will you select a Anupana suitable for? You have understood what is Raktapitta, and your patient is before you. He has a history of bleeding disorder in which the liver and spleen are affected. We can apply the Raktapitta Chikitsa there, and the best drug of choice in Raktapitta is Kasisa, which I have said. So how will you give the Kasisa Basma, in which, through which Anupana?
Sir, any Pittahara medicine like milk, or there is one answer, Sharkara,
Yeah,
Jaggery.
these all can be used, but the best one which I got the result is Vasha Sarasa, and Vasha Sarasa is actually the Agriya Aushadha for Raktapitta. So I have tried, due to that logic, the Agriya Aushadha for Raktapitta is Vasha. So I have tried it, got excellent result. So you can also use that. You can also use other option, no problem in that. Milk is good, Sharkara is good, nothing to worry. But this has got good result with the Vasha Sarasa. These ITP patient, now the platelets are rising, and the bleeding from nostrils and from the oral cavities under control. It is arrested. So from the nostrils, if there is a little bit bleeding coming out, there is a remedy for that. You can use a Pradimarshanasya with the Durvasarasa. This is highly useful. You can use a Pradimarsha with Durvasarasa along with the internal administration of this Kasi Sabaslu. And again, one more thing, when the bleeding is in the oral cavity, what is the thing which you are going to use? You can apply an application there. Can you suggest one? You can try that. No, it's not. Uh, I am making you think. So the best one for the application there to control the oral cavity bleeding is nothing but Gairika. Gairika is another Rasaushadhi which is very excellent, having excellent action in this to control these type of bleeding. So Gairika you can apply along with honey. You can apply and it is very essentially very having excellent result. So you can also use not only Kasabasma, along with that you can select one or two medicine which are very useful in the liver and spleen, which can be helpful in addressing the pathology. And Drakshadi Kashaya and Vasha Guluchadi Kashaya is the best one, which can be accompanied with the Kasisa Basma along with Vasha Sarasa. So I have made the whole picture clear and you can practice it right away. So now coming to some of the cases, this Kasisa Basma I have applied in these cases. Not going to the details, we have already discussed the different aspects of it. And now you can use Kasisa in different forms and it can have a multiple effect in different Anupanas. With the Nimbu, if you want to increase the HP level, you have to increase the HP level, then the best Anupana is Nimbu Sarasa as it is a acidic media, and it can enhance the blood production. So to increase the HB by 3 weeks, you can improve by using it nimbu. With madhu, it is an overall anupana you can use. Then vasha sarasa, which we have already discussed. With tengin pukala, this prasuna, which kera prasuna. In cases of uterine bleeding, you can use in that anupana. Otherwise, there is a tendency when we use kasisa basma, sometimes the uterine bleeding may increase in the patient. So to arrest that, you can use some of these Stambhana Aushadas as anupana. Then in Naligera Jala, it can be used, and there is a formulation called Suryakshara Kasisa, which you will be very wonderfully, you can use it in your practice in Ashmeri. Ashmeri, the urinary calculus, you can use the Suryakshara Kasisa. What is that? Suryakshara Kasisa is nothing but Kasisa plus this Suryakshara. Suryakshara means the potassium nitrate. You have to add half amount of potassium nitrate to kasisa, and you have to grind it with nimbu sarasa and make a puda. You will get surakshara kasisa. And this is very good for ashmari since it is having lekhana property, Vedana property, Ashmeri Vedana. So it should crack the Ashmeri. For that, the Suryakshara, the combination of Suryakshara with Kasisa is very much relevant. And with the Kumari, Swarasa, and the Churnodaga, there is a process to make this Kasisa Basma along with a fluid with a combination of Kumari and Churnodaga, and it will be curing fever within 15 to 20 minutes. The temperature will be dipping down. So there are various use of kasisa basma according to different anupanas. I can see some of the yogas containing kasisa also, like Rajat Pravartini and all. So how to apply all these medicines, very important. Sutrasthanartha saram suvibalamadiil സൂക്ഷ്മമായി സംഗ്രഹിച്ചും മാത്രാകാലം ത്രിദോഷസ്ഥിതിയുടെ നിലയും സാധ്യവും നല്ലവണ്ണം നേത്രത്താൽ കണ്ടറിഞ്ഞും സൂത്രം നോക്കി പ്രയോഗിച്ചിടും അളവിലവൻ കേളി നീളെ പരക്കും. Means you can become a very successful practitioner to apply these resaushadis, but you should be very wise to know the Tridoshavastha, Desha, Kala, then the Rogavastha and the Samdrapti. By knowing these, if you apply the Rasaushadhi, it will be very specific and you will get specific results. So these are the unique properties of Rasaushadhi. Salpa hi matra, vipula gunascha, sadyo hi debana pajanamcha. So minute dose, action in multiple system, and rapid assimilation. So in Chikilsaka Chindamani, which is a Malayalam Grantha, they said that Rasa Prayoga Millata Vaidin Nannalla Kevalam, which means if you are not practicing with the Rasa Ushadi, you have to refer the patient many a times. But if you know the use of Rasa Ushadi, you won't refer, you can treat it well. That's the essence of that. So, analyzing some few most important drugs. Loha Basmas, it's another variety of Rasaushadis. From the Sarna Basma to the Naga and Vanga Basma, Swarnam, Dejadam, Tamram. So, you should also know how to differentially apply these Basmas. And the common properties of all these metallic Basmas are Mridani Lohani Resi Bhavandi, Nigrandi Yuktani Maha Amayamscha, Abhyasa Yoga Drida Deha Siddhim, Kurvandi Rugjanma Jara Vinash. So it can be used in very high order pathologies, even in cancer treatment you can use. So for curing fatal diseases, you can use these metallic plasmas. So Swarna, Rajata, Loha, Tamra, Vanga. This can be used in varied pathology. And I am now pointing out the specific use of each. Swarna is best one, best rasayana, best medya drug which you can use. So in the pathologies of brain degeneration, you can select the Swarna Basma. So Rajata is also Medhya, Brahmana. But how can you differentiate Swarna Basma and Rajata Basma? Even though both are Rasayana. Yeah, say in the case of infertility, you can use both Swarna Basma and Rajata Basma. But you should be able to differentiate the use of both Swarna and Rajata. How? In a case of infertility, a patient is approaching you and you can use Swarna Basma as well, Rajata Basma. Both have good properties and you can use it in infertility. But I can differentiate the both with the thing of its property. How you can differentiate? Swarna Basma is Brahmana. Rajata Basma is Lekhana. So even though both are Rasayanas, it has two distinct properties. Swarna is Brahmana, Rajata is Lekhana. So you should target what is needed in that patient. So if the patient needs Brahmana, is Dadu need Brahmana, then you can use it for a patient with infertility. If the patient needs Brahmana, you can use Swarnavas. But if the patient say about he needs some Srodho Shodhana and some Srodho Shodhana is needed according to the pathology of that patient, then you can wisely select this Rajata Basma. So this way you have to differentiate. Both are told in infertility, but you can specifically use it by thinking about its property, by analyzing its property. Then Loha Basma, what is its specific use? Loha can be used whenever there is Taulya, you can use Loha. So it is in fact it is very specific in lowering and correcting the fat metabolism. So whenever you need to correct the fat metabolism, the specific Rasaushadis which you can select is Loha Basma. Then coming to Tamra, the specific use of Tamra, even though these are all Dasayanas, Tamra is Atyanda Lekhana, Atyanda Ruksha, Atyanda Lekhana. So in tumorous growth, in cystic growth, and all those solid masses and growth, you can deplete the tumor and the masses. You can deplete it by using the Tamra Basma. And even in Arbuda Chikitsa, in cancer treatment, this Tamra is a choice of drug. But beware that it should be used with proper dose. Only 20 milligram to 30 milligram of Tamra Basma need to be used, not more. That's the major thing. Na visham vishamityahu, visham tu tamra muchyade. So you have to be very cautious while using Tamra. So Tamra Basma, many of the Basmas, they can be used up to a dose of 130, 125 milligram or 250 milligram. But Tamra, you should not use in that dose, even though some text says about its much larger dose, you can use only in very small dose. It's the safe practice of Tamra. So in the tumorous pathologies, you can use Tamra Basma. And now coming to Vanka, Vanga is highly Dhatu Poshana and you can use it in infertility, male infertility is specific to male infertility in which these seminal parameters can be corrected with the Vanga Basma. And in those cases with chronic diabetic mellitus patient, with the modern medicine treatment, they will be very much weak. Their musculature will be very affected. And in those cases, you can use very well the Vanga Basma. Especially the Trivanga Basma is very much specific in the chronic diabetic mellitus patients. So I am telling each the specific use of each dhatu basmas. So these are the things which we have discussed. And now coming to a wonderful drug, Abraga. Abraga is very much wonderful. You say about Swarna Basma, it is Brahmana, it is Medya, but it costs much. Not for everybody you can use Swarna Basma. It is not feasible to use. So we can have a substituent for Swarna. That is Abraga. Why? Because of its property. Gauri Teja Paramam Amridam Vada Pitta Kshayagnam प्रज्ञाबोधिं प्रशमितरुजं वृष्यम् आयुष्यम् अग्र्यं बल्यं स्निग्धं रुचितमगभं दीपनं शीतवीर्यं. So what is that? Prajnabodhim. What is Prajnabodhim? What is its implication? Prajna means intellect. So Bodhim can stimulate the intellect. So it is highly medya. So where it is used, Vada Pitta Kshayagnam. So it can be used in Vada Pittottara Rogas. What is Vada Pittottara Rogas? They are degenerative disorders. You can see Vada Pittottara Avastha in degeneration. In degeneration, nothing but it is Vada Pittottara. So Gauri Teja, which is called Abraga, is Paramam Amardam Vada Pitta Kshayagnam. So it can be used in these degenerative disorders. And which kind of degenerative disorders? We should be very specific in that. In the next line it is said that it is Prajna Bodhi. So for brain degenerations, for the degenerations in the central nervous system, you can use Abraga. And the dose may be 100 milligram to 200 milligram. But you can select genuine Abraga Basma by a simple test. So if the Abraga Basma is genuine, how you know it is genuine? So simply randomly check your sample. If the sample doesn't contain any luster, then it is good for use. But if the Abraga contains luster, you won't use it. It will spoil your patient. So that is called Nischandratam, the application of Basma Pariksha. So in your practice, you should be able to apply all this which you have studied in Rasit Shastra to Basma Pariksha. Why is it for? For assessing the genuineness of Basma. You can assess it simply. So Nischandratva means the Basma should not contain luster. So it is very pertinent for this Abraga Basma. And also it has Vrishya, Ayushya, so that it was also good in increasing the seminal parameters, for increasing the seminal count, the mobility of the sperms, all are good when you use Abraga. And also for erectile dysfunction, you can use Abraga Basma along with Siddha Magaraduja. So you can use Abraga Basma with various anupanas, with the Medya Rasayana, with the Grida, with the Mahakalyanaka Grida. It is very useful in this depression and anxiety, the Manovikaras. The Abraga is good when you use along with the Kalyanaka Grida, Mahakalyanaka Grida. And along with the Medya Rasayana, Shanga Pushpi, it is good for the memory loss, the dementia-like disorders. You can use, not fully cured, but you can get some improvement. These are the cases. Some Gandaga. This is another important drug. This Adirasayana, Deepta Anala Pajana, Ama Shoshana, Aman Mojana, Vishahara, Krimihara. So, if the liver function of your patient is affected, Gandaga can bring in the changes, especially for skin disorders. How it acts in skin? So it is Dipana, Pajana, Amon Mojana, Amashoshana. So the Rasadhatu of your patient will be cleared if you use Gandaga. So if the Rasadhatu gets cleared, then your tok will be good. The new tok will come healthy. So that's why it's very good in skin disorders. So the different applications of Gandaga Vasma with Shira, with the Grida, these are the best anupanas. As even though many of the patients have the allergy to Gandaga, if you make it proper Shodhana, then you can get rid of that Gandaga sensitivity. If the Shodhana is so good, the patient will not get any sensitiveness. So it can be used very well in the skin disorders and even in indigestion, Ajirna, you can use it in Nagara, Churna and Tambula Swarasa. Along with Guluji Sattva, you can use Gandaga in wounds, in non-healing wounds. And Gandaga Rasayana is a very excellent combination in which the Shodhita Gandaga is being made bhavana with Guluji, Tribala, Trimada, and all. And it's a very excellent medicine in all types of skin disorders. Whatever be the skin disorders. The only thing is that you have to be careful when it is used in Paitiga patient. Pitta, Pitta Prakriti patient, you have to observe the dose. The dose should be minimal and you can derive results. And external applications of Gandaga is also important, like Gandaga Malahara. It is like ointment. And many of the times the oils, by the use of oils, the skin lesions get flare-ups. And you can use Gandaga Malahara as an alternative for that. And the Navani Dajam is one which I have prepared by using the milk which is gained from the purification process of Gandaga. You can make it a curd of that milk and with that Gandaga and you can convert it into Navanida butter. And if you apply this externally to the cuts, the Vibhadika is very active. Within 2 or 3 days, you can see the results. So precisely the dosha shamanatama vabhragam is vada pitta shamanam. The loha is pitta shleshma shamanam. Tamra is kaba pitta shamanam. Vanga is kaba vada shamanam. Kasisa is pitta shamanam. Kandam is vada shamanam. Kanmada, Tangana and all are kaba shamanam. So you can have a idea regarding how to apply these in various conditions. I am not going to the details of the cases. If interested, I can discuss in another. So we are running out of the time. Some other basmas, the Shilasit basma, which is also called Godandi basma. The gypsum is actually incinerated. It is very useful in urinary tract infections. And 1 gram per day can also be used. Then Shanga basma is very excellent in Amla Pitta. In all the acid peptic disorders, you can use Shangabhasma right away. But it is better to get good result if you have a Shodhana uh, for Amla Pitta, and after the Shodhana, if you use Shangabhasma, you will get maximum result. So you can use a simple Virejana with Avipatti Churna, and then you can use Shangabhasma. You will get excellent result. And you can also use Dhatri Loha along with Shangavasma, and best result can be achieved. So many of the patients, they are taking antacids. While you can see many of your patients, they are regularly using antacids, many of them are cancerogenic, cancer causing. So you can avoid that in that patient. You may substitute it with Shangavasma. And you can see these Shangavasma, Kasasabasma, these are not mere supplements like iron supplement or calcium supplement. They are actually correcting the metabolic pathway, and they are bringing in balance the metabolism in the patient and not as supplements. So you may not consider this as simple supplement. They are they are excellent resinas to correct the metabolic pathways. Some rare medicines like pishti, they are pravala pishti is very much useful in this Paitiga Avastha, which sleep is disturbed by acidity or in the patient, the sleep is disturbed, you can use Pravada Pishti. And also in the perimenopausal conditions, the patient may be ending up with some mental agonies and some hormonal disturbances and hot flushes. In that, Pravada Pishti is an excellent choice, and you can also use Gandaga Drudi, 2 or 3 drops of Gandaga Drudi along with the beetle leaves in some of the conditions of the TB. And the Malaharas, you can use a wide range of Malaharas, starting from Gandaga Malahara to Gairika Malahara. So the application of research chikitsa is varied from degenerative diseases, genetic disorders, cancer treatment, emergency management, and to minimize surgeries. So in acute cases like acute respiratory diseases, when the patient is gasping before you with acute respiratory distress, what will you do? You can treat him by using Shwasakudara Rasa and using a Dhumapana with Varti containing Aridala or Manashila or with Shwasakudara Rasa. And by 5 minutes, the patient will get relief. You can try it in your clinic. Excellent result. In acute respiratory distress, the patient is gasping before you. You can use this Dhumapana with Shwasakudara Rasa or Aridala. So check the turbinates. If the turbinates are inflamed, you can use it directly. If it is not inflamed, just to make a Dhumapana with Haridra. That's all. But the Shwasakudara Rasa is an acute medicine. We can use it as an acute medicine in acute stages of respiratory distress. Shwasakudara is a best choice than Shwasananda, since it contains Aridala and contains Manashila. It can be used. Kabhavadadi condition. We have already discussed about Chardi, and the Sudha Shekhar Rasa is good, and Legu Sudha Shekhara is good. Then Vettumar Guliga with Kajura Sarasa, Rasa Sindura, and the specific one is this Mayura Picha Basma of 30 milligrams along with Amalagi Churna. But you should identify the cause of Chardi, and once the Chardi is got aggravated, you can't control because the center of vomiting will be stimulated, and it's very difficult to control if it is stimulated. So before that, you should be able to administer the medicine. Then Kasa for dry cough, you can use a throat paint with the Tangana Basma with honey. This application as a throat paint or gargle. Then tonsillitis, you can use Vadiga Basma with Tulasi Sarasa, you can use as a throat paint. For laryngitis, pharyngitis, and tonsillitis, it works like anything. Then cough with fever, we have already discussed about Surya Prabha. Then for productive cough, you can use Kabhakedu Rasa, and along with Swasananda Guliga and the Kanagasa as a combination. So in Grahani, many of the times the patient complains about indigestion. The particles in the stools, many of the times some of the white in the stools, it is appearing some whitish, some frothy stools, and that's the best way to identify a patient with Grahani. And you can use Shankabasma, 200 milligram, and as a combination, Arogyavardhini Rasa, and as a Sahavana, Kaidaryadi Kasha is a best combination, which is excellent, having excellent result in Grahani. And Adisara, Ashtakshari Guliga is the best one, along with Sedu Bandha Guliga. So in Amlavanta, which we have already discussed about Shangabhasma, and a combination of Dhatri Loha, Arogyavardhini Rasa, and Padyaksha Dhatradi Kasha is a very excellent combination, which is working in different conditions of Ambla Pitta. So now coming to Hrutshula or Gulma, you can see that the Sringa Basma, Pravala Basma, Nagarjuna Abhrarasa, Kalyanakshara, Shangavadi, Hridayarna Rasa. We have a lot of choices, but you have to differentiate its use. Hridayarna Rasa contains Tamra more. So if the condition contains a block, cardiac block, you can use Hridayarna Rasa. But if the valves of the cardiac system are affected, you can use Pravala Basma. And if the muscles of the heart are weakened, then you can use Nagarjuna Brarasa. Likewise, these can be differentially applied according to the pathology of the patient. Now the Mutra Krichra, Shilasat Basma, that is Godande Basma, is best. Mutra Krichra, Ashmeri, Prameha, Pandu, Kamala, Nashana. So all these pathologies, 4 or 5 different pathologies in which lot of diseases comes under this umbrella, the Shilasat Basma, which is essentially the incinerated Godandi, can be used. Now coming to the last area, the Vada Roga, the Vada Gajankusha Rasa is specific for Pakvashya Gada Vada, Pakvashya. So you can see the different diseases in Pakvashya Gada Vada, and for that Vada Gajankusha Rasa is very useful. Especially in the disc prolapses of the disc, it is very useful. Vada Vidvamsana Rasa is good for Dhadukshaja Vyadi. Vada Rakshasa Guliga is in Samavadam. Then Brihadvada Chindamani Rasa is specific in Pakshagadam and Ardidam, which are Mahavada Vyadis. And Brihadvada Chindamani contains Swarna Basmati. So it's a little bit costly. One tablet costs about 80 to 90 rupees. So Mahayogaraja Gugulu can be used in OA. Then Smridhisagara Rasa is specific in Abhasmara patient. Then Abraga Basma is good in degenerative disease of brain like Parkinsonism and Parkinson's spectrum of disorders, and for the brain development and anomalies in children. So these are the specific use of all these Rasa-Aushadhis. So in Yagrat Vigaras, in Kamala, you can use Hilasat and Mandura Basma. In cirrhosis, even some of the stages we can treat with Anabedi, that is Kasisa Basma, Kanda Basma, Arogyavardhani Rasa, Vasha Gluchadi Kashaya, and Shanga Basma and Kumari Swarasa can be applied in all those having Pitta Adhikya, with the bile secretions more. Uliga is one of the best choice, along with Vasanta Kusumagara Kasa, Loha Basma, Abraga Basma, Vanga Basma, and precisely Trivanga Basma, which is very much important in diabetic mellitus patient with chronicity. Now in Amavada Rasa is very good with the Eranda Taila. You should use it with the Anapana Veranda Taila, it will get maximum result. Then Simhanada Gulguru is good in Vadarekta too. And Pipali Jira Kwada, you can use Rasa Sindura. So Rasa Sindura has about 40 and above indications. We can cover it in another session. It is very large. So many of the toxicity studies have done, and even Tamra, which is Visha, which is said as Visha, and even Garbha Bala Rasa, which contains Naga and Vanga, Rasa Sindura, all cleared toxicity study. So if you purchase from a genuine source, you don't have to bother If you give it in the right dose, it will be safe. And you can use it differentially. That's what I have instructed in all these classes, how to use it in your practice. And these are the salient features of these rasaushadis. They are very minute. So it's an attribute to its speedy action. Then the it not only acts in Annamaya Kosha, but it influences the subtle koshas like Pranamaya, Manomaya, Vijnanamaya, and even the Anandamaya Kosha. So that the yogis made use of these rasa, chikilsa to attain perfection in life. And it is called Devi Chikilsa. It is actually an expansion of Rasayana Chikilsa in Ashtanga. And almost all the rasa drugs have Rasayana property. You don't have to fear it about. It is excellent medicine, but use it wisely. So there is also a concept of Kshetrigarana in Rasa Chikilsa, in which if you use it as a Rasayana, then do a Panchakarma before that. And the Panchakarma which is described in Rasa Chikilsa is nothing but Pajanam Snehanam Swedo Vamanam Rejanam Tada Edani Panchakarmani Yadavyani Vishagvare. So these are the Panchakarmas before you administer the Rasa Ushadi for Rasayana purpose, not for disease purpose, but for Rasayana purpose. And it is called Kshetrigarana, in which the cells are made to respond to all these rasayanas very well. So action in system biology, the typical example is Arogya Vardhani Vadi, and it is a broad spectrum medicine which you can use in lot of pathologies. Dipani, Pajani, Padya, Hridya, Medo, Vinashini, Malashuddhigari, Nityam, Durdarshat Pravartini. So you can apply it in to correct all the metabolic derangements happening in the patient. So as an emergency medicine, you can make use of the Potali Kalpanas, including the Sorna Garbha Potali, Tamra Garbha Potali, Hema Garbha Potali, Loha Garbha Potali. You can use it as emergency medicine since they are very potent, and by grinding it in suitable anupana and licking to the patient's tongue, within hours you can get the result. So these are the guidelines about the dose. You can follow these guidelines. Sagandha and Nirgandha. If the Rasaushadhi is Sagandha along with Gandaga, the Rasa along with Gandaga is very safe to use and it can be used for long. But Nirgandha you should only use for certain dose. For 3 days you can cut. You should cut that. You should cut the medicine. That's one of the guideline. And Sagni and Niragni. Sagni is safe. You can use the Basmas, you can use the Sinduras. But Niragni, like Rasagandhi Medigo, you should restrain it for 41 days, take a gap for another 2 to 3 weeks, then again use it if needed. That's all. And the dose for children can be adopted from the dose of Rasa Sindura. Up to 1 year, you can use below 10 milligram. Up to 2 year, you can use below 20 milligram, not more than 20 milligram. And aged 6, the Risaushadi or Basma or Sindura, you can use around 40 milligram. And for a child aged 12, you can even use up to half the maximum dose. And adult dose is usually 1 dati. And there will be some fluctuations according to the condition. This is a general guideline. So these are the Pratyaushadhas, the antidotes. Sometimes, at times, you may sometimes witness some sensitivities. And for addressing that, these antidotes are very useful. Tangana with Madhu can have a greater role in the oral cavity, the sensitivities of oral cavity. Then Chira with Gograda, especially for Gandaga, sensitivity of Gandaga. Kushmanda Sarasa for arsenic antidotes. Aridala and Manashila, you can use Kushmanda. Nagavelli Sarasa, Marija Churnam for Resa, and Durva Sarasa for all the Stavara Vishas. And Vibhidaga Kwada for Baladaga. Tribala Churna can be used as general. There are specific antidotes which are told in Brihat Rasaraja Sundaram. You can refer Brihat Rasaraja Sundaram for specific antidotes. And I am coming to the conclusion that Rasa Chikitsa is very excellent. You can gain excellent result and edge if you use rationally. You should judge the condition of the patient. You should select an appropriate dose, the duration of use, dietary restriction is important, Anumpana is important, and regular monitoring is also very essential while using RSA medicines. Thank you for your patient hearing. We could not come across a branch in modern medicine equivalent to Rasa Shastra. It can be developed as a nanomedicine or nuclear medicine of Ayurveda. The ancient wisdom of converting a poison to the most potent medicine requires a lot of self-discipline and perseverance. But the fact that it benefits the entire humanity is the inspiration behind such painstaking efforts and bowing our head before such great cheers. Thank you. Thank you.
Thank you so much, sir. It was a wonderful session. As I told you in between, that Rasa is a place where we always, we have a bhaya to go to keep our hands on Rasa. But with this session, I think you have given confidence to practice Rasa, sir. Sir, we have few questions in the chat box. Can we go for the
Yeah, definitely.
Okay. Um, sir, can you please mention the doses of Jaya Mangala Rasa for pneumonia in children?
Yeah, Jayamangala Rasa, the adult dose is 60 milligram per day. So you can split the dose according to the child's age. So I can think the pneumonia 20 milligram to 30 milligram is a sufficient dose to a child. You can use it in that dose.
Okay.
But you have to restrict the use for certain days. Not more than 2 weeks you have to use. Long term use is not advised.
Sir, next question. Can we use Kasisa Basma in menorrhagia conditions?
Yeah, but the thing is that many of the times Kasisa when used can prompt more uterine bleeding. So it is better to use Kanda Basma instead of Kasisa there.
Sir, next question. Sir, some patients have HB level normal but iron deficiency. How to understand this pathology according to Ayurveda and which kalpa can we use?
Once more, can you repeat the question?
Yes, sir. Sir, some patients have HB level normal but iron deficiency. How to understand this pathology according to Ayurveda and which kalpa can we use?
Yeah, that's a very good question. Many of the times, these biomarkers and bioinvestigations, they are only aid. So I think there is a problem with the metabolism of iron. So for that, we have to correct it. So not by supplementing it, but to correct the metabolism. So the best way to treat is with the kalpa, rasa kalpa you can use is arogya vartani, since it corrects the jadaratmi as well as the dhatratmi. So the metabolic error will be corrected, and by the use of 2 to 3 months, along with Dadimadi Grada, you can use it, and the iron metabolism will be corrected.
Sir, you had mentioned Surya Ksharan in Ashmari Chikitsa. So, what is the dose and Anupana, sir?
Yeah, Suryakshara Kasisa. It's a combination which contains Suryakshara and Kasisa. Why I have told it in Ashmari is that the Suryakshara is Vedana. But many of the times you cannot procure. Uh, you should make it. If it is not available, you can again use instead of that Shweda Parpadi. It also contains the Surekshara. So why Surekshara? It is highly Vedana and it can make the Ashmari Vedida. It can crack the calculus so that it can go through the urinary tract. The urinary tract, it is 4 millimeter in diameter and you have to crack the stone so that it will go out. If you give this Shweda Parpadi or Surekshara Kasisa, you can see many of the patients picking these stones with them and coming to you. So that's the case. And the dose will be, therefore, Surekshara Kasisa 100 mg is enough. But when you use Sweda Parpadi instead, you can use up to a dose of 500 milligram to 1 gram even. It is very safe. Only 3 salt are there. So 500 milligram to 1 gram you can use the dose of Sweda Parpadi when you are using it. So Surekshara it is 100 milligram, but it is not available in the common pool. That's why you can use instead Sweda Parpadi with a dose of 500 milligram to 100 milligram, which contains Surekshara.
Okay. Okay, sir. Sir, next we have a small case. Patient aged 37 years, female, history of typhoid fever 3 times. After relapsing fever, her thyroid titer always positive and complained of sarvanga daha along with maxillary polyp, left eye lacrimal duct swelling, kapha vataja symptoms mostly, hetu sankarpajanya. So, what can we do in this case, sir? Any?
Yeah. This case in which we can see 2 or 3 things we should pick up in the pathology. First one is there is a Dhadu Lina Avastha. It has having a chronicity of infection and the Dhadu Lina Avastha and Vishama Jara. So you have to pick up that pathology. Along with that, some Vaitiga problems, some of the infections get there. So the some problems with the in this patient, some of the problems with the lymphatics also. So you have to select one such medicine to target the lymphatics also. So for that, the Arogya Vardhani is a best choice along with the Kashaya Kirada Tikta Kashaya. Tikta Kirada Tikta, which is mentioned in Kushama Jara of Charaka Simheda. You can take that Kwada as Sahabana along with Arogya Vardhani Rasa. Along with Arogya Vardhani Rasa, you can combine Lakshmi Vilasa Rasa, Naradiya Lakshmi Vilasa Rasa for treating the infection. And again, one more medicine you have to use to correct this lymphatics for this patient, and you can use Nityananda Rasa, which is said in Slipada, and it will act in the lymphatics, the Rasa Dhatu, and it will be corrected. So you can use Arogyavardhini and this Naradiya Lakshmi Vilasa Rasa combined 2 times a day along with the Nityananda Rasa 100 milligram per day, and you can use a Kashaya, a Sahabana, which is told in Charaka Samhita, Vishama Dhadu, Vishama Jara Chikitsa, with the Tikta Kirada Tikta. It's that Kashaya Kwada can be used as Sahabana. These can be combined in the treatment.
Okay, sir. Sir, one of our participants would like to talk to you.
Yeah.
Hello, sir.
Yeah.
Good evening, sir. I have shared now the case now. Sir, she has a pituitary gland. Pardon, sir?
You are from which place?
Bangalore, sir.
Okay.
Dr. Ujwala here, sir, from Bangalore. Sir, this case, my diagnosis after this case was a Shotha because all pathology is gone to Shotha because lacrimal glands swelling again, maxillary polyp, and again she had this pituitary gland swelling also. And I thought it is Aurojanya, So that Hastapada Daha is not proper Pitta, it's because of Avrodha of Pitta. So,
Yeah.
so this will be correct, na sir? Means if we give this.
Yeah, it will be corrected.
Okay, sir. Thank you.
Yeah, it will be corrected. You can contact me after the use of 2-3 weeks. You can contact me.
Okay, sir.
It will be. It will take 1 or 2 months.
Okay.
After 3 weeks, you can contact. We can change some medicine according to the condition. Yeah, understand.
Sir, can you please tell us your number so that I can share it with everyone?
94461
944
94461 74940.
946. Okay.
94461 74940. So these are the things which I have gained from the practical application, not only from text. So I am confident to tell you that this will work. And if you have doubts, you can contact me.
Sir, few more questions are there. Can I read?
Yeah.
Okay. Sir, in kids, which Rasakalpa we can use in recurrent viral high fever and to increase the immunity also?
Yeah. These two or three things which can be applied, but we should personally each cannot say a general one, but Jasa Sindura is one thing which we can use. And along with that, you can use this Uramarunu Guliga. Uramarunu. Masuri Guliga is also there, which is in Arogya Kalpa Drumam. It's very specific. Masuri Guliga. And it will Resisindura in small dose, according to the age of the child. I have shown about the dose which can be used in each age. So you can select that. It is safe. From a good source, if you select, you can use it. Along with that, this Masuri Guliga you can use. And this Udamaranu Guliga also for the child. So it will be corrected.
Okay. Sir, Kachura Swarsa means what?
Kachura means shadi.
Shadi. Okay. Sir, what is Shilajit? Shilajit.
Yeah. Shilajit. Actually, Shilasat is a local term which is said for Godandi, incinerated Godandi in Kerala. And many of the time it is labeled as Kanmada Basma. Many of the pharmacies, Kanmada Basma, they say Kanmada Basma, but it is actually incinerated Godandi, not Gomutra Gandhi Shilajit. This incinerated Godandi.
Sir, dose of Trivanga Basma in diabetes mellitus.
You can use up to 200 milligram per day.
Sir, there is a question. Can you suggest any authentic Rasa Ushadi pharmacy or manufacturer?
I used to use from, if the doctors are in all India basis, I can suggest Doodh Pabesha, Sri Doodh Pabesha. They have the products are standardized, no threat of toxicity. And Baidyanath, Kashmir, so many pharmacies are there which can be used. And in Kerala, we have some Siddheshwara in Palakkad. Then in Tamil Nadu, there is Infops Adayar. Bombay, Sri Dud Pabeshwar is there. They are distributing all over India. Baidyanath, Kashmir Pharmacy, all these are good.
Okay. Sir, another one case is there, sir. Patient age 40 years, female, with weight 90 kgs, with recurrent Mutra Ashmari, 90 kg weight. With recurrent Mutrashmari, iron deficiency with fatty liver changes. Which Rasakalpa can be used? Doctor thinks that it's related to more kleda and yakrit vikriti. Santarbajanya hetu.
Definitely. 2 or 3 things which we can look into that is actually it is what the doctor